Hello Indonesia, I am Wahyuningyan Arini, the most outstanding student 2017 of Brawijaya-University.
Sudah ada strategi dalam penanggulangannya yang disebut Directly Observed Treatment Short Course DOTS, namun jumlah penyakit tuberkulosis masih saja tinggi. Saat ini Indonesia menempati peringkat keempat negara dengan penyakit TB di dunia setelah Cina, India, dan juga Afrika Selatan.
Tuberculosis is the disease that is among top 10 deadliest diseases in the world. Tuberculosis is caused by bacterial infection of Mycobacterium tuberculosis that attacks the lungs, causes the disability, and can lead to death. Tuberculosis has caused the death of 1.4 million people in the world. So far, tuberculosis standard therapy is to take several different antibiotics such as rifampicin and isoniazid to inhibit or stop the proliferation of bacterial cells. However, it takes lengthy treatment time between 6 months up to 3 years. And yet, this lengthy treatment still cannot ensure 100% recovery of the patients. Mycobacterium tuberculosis have been reported to have an antibiotic resistance, which can lead to a lengthy healing process. The resistance of Mycobacterium tuberculosis against exogenous antibiotic is caused by the efflux pump mechanism. Efflux pump mechanism is a process in which exogenous antibiotic is pumped out of the bacterial body through the bacterial cell membrane and causes antibiotic to exit before degrading the bacterial cells. In order to increase the success of tuberculosis treatment in Indonesia, I propose combination of hybrid herbal and antibiotic as Mycobacterium tuberculosis efflux pump inhibitor and immunomodulator towards tuberculosis-free Indonesia 2050. The hybrid herbal contains anti-efflux pump capsaicin, piperin, and also immunomodulator, namely filantin and terpenoid. Indonesia, as a country with the second largest biodiversity in the world, has materials to produce hybrid herbal that can enhance the success of tuberculosis treatment. Capsaicin is available in cayenne paper, piperin in black paper, and filantin and terpenoid in maniran leaves. Materials to make hybrid herbal are cayenne paper, black paper, and maniran leaves, each crushed with mortar and pestle with absolute ethanol solvent. Then, it filtered and separated with ion changer chromatography to get capsaicin, piperin, filantin, and terpenoid. Then, extracts are mixed and become hybrid herbal that can be applied with commercial antibiotics to against Mycobacterium tuberculosis. The efflux pump mechanism can be inhibited by capsaicin and piperin. Capsaicin inhibits the interaction of bacterial P glycoprotein with antibiotic in the NOR-A efflux pump. NOR-A efflux pump can let antibiotics to get out of the bacterial cells. Piperin inhibits RT1258C, the bacterial transporter, causing antibiotic resistance. The inhibition of efflux pump can accelerate the destruction of bacterial cells by antibiotic. In addition, hybrid herbal also contains filantin and terpenoid that can serve as immunomodulator to improve the work of immune system of tuberculosis patients. The hybrid herbal compound can be applied before or along with antibiotic to increase the effectiveness of the antibiotic, thus can cure tuberculosis disease faster. This innovation, which is based on local Indonesian wisdom, can be developed to be a national product with a low price for tuberculosis treatment. The application of hybrid herbal combined with commercial antibiotics can increase the effectiveness of antibiotic action and speed tuberculosis disease recovery up to 2 months. Further research needs to be done to determine the effective dose according to the level of infection, clinical trials, and development of hybrid herbal. This innovation brings a new hope for a more effective tuberculosis treatment, and thus to reduce the number of tuberculosis cases in order to realize the Indonesian government program of free tuberculosis in 2050. So Indonesia, let's go ahead to get help.